Hi everyone. So in today's video we're going to talk about oral placement therapy, which is also called as oromotor therapy. So basically we use oromotor therapy to give stimulations to a child when the child has some kind of feeding difficulties, the child is unable to feed properly, the child does food pocketing. That means the child keeps the food either on the sides of the cheeks, or the child is mouthing too much, so a child is a seeker. So in those few cases, like these are a few examples where we give oromotor therapy. So I'll give you a few like tips and tricks how we can actually use the technique to give stimulations. So I have this vibrating toothbrush. So how we do is we just switch it on. Okay, so this child, Sampreet, is very old and like is very familiar with all these things. So he might not be cranky or get irritated with this. But otherwise, when you do oromotor therapy, when you just start with the child, like the initial stages, so try to give stimulations on the distal parts first. Like just try to make the child familiar with the object. So you have to start giving stimulations from the distal part of the body. Like you can start with the hands, with the fingers, then gradually move up and up, move towards the neck, and then come to the cheek and the mouth part, because the child needs to be more comfortable first when you start any like a new activity with the child. So with him, what I'll do is I'll just give stimulation on the cheek areas, starting from the root of the lips, stimulating and moving it slowly up like this. So you just have to move it in a circular motion like this, starting from the root of the lip, going up towards the cheek. So the child might feel a little ticklish because this gives like strong vibrations. Same goes to the other side. Say hello, Sampreet. No. Say hello, everyone. Hello. Okay, so this was the cheek part. So I just gave stimulation on the cheek areas. Now what I'll do is I'll give the stimulation on the chin. Like this. So this child is quite familiar with the oromotor technique, so that is why he is cooperating quite well. But otherwise, usually children having feeding difficulties and all of these oromotor issues, they do not cooperate so well, because this actually stimulates them and the children might feel a lot of like ticklings. So that is why. So this is how we give the stimulation. Okay, so I gave the stimulation on the chin area, on the upper lip as well, and now moving on to the lip area. Okay, so a lot of children also do verbal stimming, this thing. So this is called as verbal stimming. So for this also I have made a separate video. You can watch that video too to know the details about verbal stimming. So in cases of verbal stimming, when the child does the stimming to seek auditory sense or to seek the vibrations inside the mouth, in those cases also we can give oromotor use oromotor techniques to make the child comfortable and to just fulfill the sensory diet what the child is seeking. Okay, other than this, what we can do is we can go with the tapping on the cheeks like this. So simply you need to tap on the cheek area, starting again from the root of the lip and going towards the ears like this, and then rotating the chin, rotatory movements, just to give the sense what he is seeking for, and then on the other side. Sit down. Sampreet, sit down. Come. So this is how the child might behave when you give them oromotor stimulation, because this is something which does not interest the child so much. So they might feel a little bored or disinteresting with that. Also, you can sing some rhymes or sing recite some kind of stories to build that interest with the child. So this is how we need to do the tapping. Other than that, we have a chewy tube as well. So this is a green color chewy tube. There are different colors available which are actually dependent on the resistivity that this chewy tube provides. So again, he is coming from a very long time now, so we are doing the chewy tube part as well almost regularly. So he is quite again comfortable with this. So you have to put it on either sides and see the way he's chewing and taking the sense. So like this, you need to make the child chew on both the sides. This usually helps when the child is mouthing too much, you know, biting or cutting a lot of things, lot of random objects or toys. See, in between he sucks. So this is how he's, you know, expressing his need. Okay, so this is how you need to make the child chew this. Also, today I am not using any kind of textures, but usually you can use different kind of textures like curd, you can use honey, you can use flavored yogurt, or you can go with the orange juice, like the pulp and the juice, just to give them different textures when a child is not getting comfortable with different food items and they have become picky eaters. So in those cases also you can give them different textures to make them comfortable with this. Okay, now when the child is mouthing too much, what you can do is you can put the chewy tube like this and hold the jaw and press it downwards, just to give them the pressure what they are seeking. So this is how oromotor technique works. So this is like a very small short video for the oromotor technique. There are a lot of things, a lot of areas that we focus on, like blowing, sucking, etc. So these were the very few simple small tricks which you can help your child with at home very simply. But still, if you have any major concern, do consult an occupational therapist or a speech therapist, just because they are the best people who can help and guide you with all these concerns. And if the concern is very small, you can just simply contact an occupational therapist, just to get guidance quite well, so that we can help your child at the earliest, because the earlier you start with the therapy, the better and good results you get. I hope this video was beneficial for you all. Thank you so much for watching. Also, if you are new here, do subscribe to